Hi, it's Julien at the Spinal Health Centre here in South Morton. I'm with Heather, and I'm just going to go through and do a film of what would happen if you come in for when you come in for a first adjustment. So a routine that we all know here, but it's worth it. Actually, you can just watch and so you know what's coming up. So the first thing we do is if Heather, you've got anything in your pockets, stick them in here. What we got, we normally have, there we go, the kind of normal cupboards, and we'll just pop that basket down there. If you stand at the end of the couch there, knees down, climb up and just lie down. Okay, and while Heather's just getting herself comfy there, there's three things that we definitely know make this whole process work a lot better. So I'll just talk you through those. I'm just using my hip to get it to the right height for me. Okay, so the first one is I've very carefully got Heather on from the back of the couch, because if we do that, basically it keeps her spine nice and straight and really helps us get accurate readings when we're actually going through and figuring out where we need to adjust. The second thing is you'll notice that Heather has her shoes on, in these case just basic trainers, and actually we know that what's called the inter-examiner reliability, so it will be me checking against me each time, or if it's one of the other team checking, the accuracy vastly improves if we're checking people in their own shoes, simply because your postural distortion patterns reflect into your own shoes. And then the third thing is, and the reason I'm just talking now, is I want Heather lying down for as close to 5 minutes as we can muster. The simple reason for that is getting gravity off all her load-bearing structures. So in this case, the spine and the pelvis and the hips and the knees and the ankles on both sides. The longer she's actually lying down, the more that our bodies relax, and so that makes a big difference. So that's the very long version. How I often phrase it when we're in here is saying, get on from the back, make sure you wear these shoes, and just lie down and chill out for a couple of minutes, because it definitely works better. By the way, on the shoes, trainers are good, normal shoes are good, short boots are good, long boots don't work, and don't ever come in here wearing flip-flops, please, because we just have to use the adjusting boots. Okay, so we then the next thing is we're going to run through what's called the essential scan, and I'll kind of talk you through it as we're going along. First thing we're going to do is check to see if there's any variation in what's called the leg length. It's called the leg length inequality test, sometimes referred to as the PD or pelvic deficient test. And I'm doing a very specific thing with my fingers here, and fingers either side. And I can see that Heather is a couple of millimeters short on the right side. And when we lift up into what is position 2, I don't know if you can see there, but she comes up basically level, which you would expect. That can be wildly different, and in some people we will see, typically if it's more than 1/4 of an inch, that's usually associated with problems in the lower back or neck. And I will see anything, people who've had traumas and accidents, it can be 1/2 to 3/4 an inch, and occasionally we'll see people it's more than an inch difference. Beyond about 1.5 inches difference, you then start to be concerned that there's actually structural differences, and they need more intervention than we do here. However, the aim is, because these are functional postural distortions, that we can actually change it, and it will change, it will change on the couch, and then we just repeat until we get to where we need to be. Okay, so basic scan, or essential scan as it's called. We start with the knees, and I'm putting some pressure down either side of the knees and looking to see if there was any change, which there is not, but the adjustment would be one onto the ankle and then one onto the knee. Actually, Heather is okay, so we move up onto pelvis. And pelvises tend to rotate either back and down on one side or up and forwards on the other. So we are seeing if I can get any change there. And actually this next one is onto the sacrotuberous ligament, basically a shove in the backside there, and actually I do get change. So if I push onto the back of the pelvis there, hopefully you can see that actually makes that right leg go short. And if I go onto the sacrotuberous ligament, we actually get level. Fantastic. Good. So 3 points of adjustment. Using the Activator tool here, for pelvis and lower back we are on setting 4. First point is what's called the spine of the ilium. Second point is on that sacrotuberous ligament, and the third point is the iliac fossa and hang over the sciatic nerve. So effectively bone, ligament, and then muscle. And we can recheck, and that feels good. And actually what I can feel, and Heather might be able to feel, is that's actually made her legs feel looser. Okay, right hand up behind your back. And swap your hands around. And here we are checking the major lumbar, so lumbar 5, lumbar 4 and lumbar 2, and both hands up behind your back. Both back down by your side. That looks okay with Heather, but if I was going to adjust lumbar 4, I'd be coming in onto lumbar 4 and doing an adjustment here and through the plane line of the facets. We move up now onto thoracic 12. Take your right hand up by your face. Okay, now you can see maybe there, just see that, it's quite clear to me. She's pulling a little bit on that right side. Big deep breath in and out. And left hand up as well. That's the T8 test. Both back down by side. So through the thoracics we check as part of the essential scan, thoracic 12, 8, 6, 4 and 1. And that happens every visit we go through because they're such important junctions and they come up so frequently, we will check it every single time. And as you can see, the aim is to not need to adjust because there's no obvious difference. But I'm going to adjust T12 here. 4, 3, 2, 1. So I'm just counting up the spine out to the transverse process of T12. Setting 3. And there's a definite pause after the thrust is delivered. Okay, we move up to thoracic 6. Turn your head to the right. Lift the right shoulder off the couch and back down. There's a T4 on the left. Both shoulders up towards your ears. Back down. Squeeze the right elbow flat against your side and let go. Squeeze the left elbow into your side and let go. Shrug your shoulders up and roll them back. And head back into the center. And for those of you that are keen-eyed will notice there were 2 points where the leg length actually changed. The first one was the T4 test on the left when Heather lifted her right shoulder off the couch. And then the second one is when she squeezed her right elbow into your side and I lifted up the legs. There was a definite change in leg length, which is a right lateral scapula. So as you can see, I'm on setting 2 here, so half the force I was using on the lower back. And well, most people will tell you actually it feels as if I'm turning the tool up and it actually feels more positive. But, it's a very effective, well, I would say it's gentle. Would you say it's gentle? It's exactly the right amount of force to get the change that we need. Let's lift up your head, back down. So in the neck we check cervical 5 and then the atlas axis, so cervical 1 and 2. Tuck your chin down to your chest, back to center. And then you can see, gone short right, long on the left. Tuck your chin down to your chest. Setting 1 or setting 2 for this. We'll do it on setting 2. And head back into the center. Push your face down into the couch and let go, which is a test for the occiput. And then the final part of this, stretch your right hand towards your right knee and let go. Left hand to left knee and let go. Okay, and that's all okay. Okay, so that's what we call the essential scan, sometimes referred to as a basic scan, but we like to call it the essential scan. And that is what we will do, certainly on the first time you get adjusted, and usually it gets checked through every single time, but often the first 3 or 4 treatments, that's all we will do until your body starts to respond and change. And then we can start adding in more tests and becoming more complicated, depending on what was the symptoms or issues that you came in and that we've found when we did our assessment. So hopefully that gives you an idea of what to expect when you first come in, and I look forward to see you in our centre.